everyone. In this video we will discuss the panoramic creation and nerve tracing procedures. Now we have this opened CBCT image and model is already matched in the previous video. We will start by clicking on the Solid Studio Hub icon, and then the first thing we need to create a panoramic curve. So we click on the panoramic. In the first step, we need to set the plane of the axial cuts. In certain cases, sometimes we have the patient head is tilted, so need to correct the orientation of the axial plane, so that when we draw the panoramic curve, it has to be along the inclination of the anterior area. In other cases, sometimes we need to create a panoramic curve for the upper alone and the lower alone. So in this case, we just do a little bit a slight tilt, so that we make sure that the anterior mandible is parallel to the red line. So then we go to the next step. Then we need to draw the panoramic curve. In the drawing, we need just to do several clicks. We need 5 to 8 points so that they determine the panoramic curve. We click the first point here. Then we move the mouse without holding the button. We release the button. Now at this point we do another click. Then we move a little bit more, and then we do another click. In the center we do a click. On the other premolar, another click, the molar, and finally we don't do a click. We just use the right button to end our panoramic curve creation. Once we are done, as you can see here, we have the panoramic curve. From the panoramic image, we can change the thickness of the cut. You can see here if you want to do a thin slice, or you can go back to thick slice, so that you can see the structures perfectly. And if you want to move along the panoramic curve, just with the left button, you can just move your mouse, so you can see the cuts at the desired or selected area. Now the next step would be the tracing of the nerve. To trace the nerve, we start by clicking on the Solid Studio Hub and we go for the nerves. Now the first thing, we need to set our cross section into we have here the right side and the left side. We try to go to the nerve, and we need to rotate. Now if you move the mouse away from the center, the icon will change into a rotation icon. Now we just drag it so that we can see on this cut, the sagittal cut, we can see the nerve along the bone. So now we can start tracing the right nerve. Now as you can see, the mouse icon is different. Just we do we need to click on start. Now the mouse icon is different. You just do one click or another click, click, and click here, click. Now at this area you can see that the nerve is disappearing. So we have two different options. Either we use the mouse scroll, we select here the last point, or we can go to another section. We can complete the nerve tracing on other section. Either we go to the as you can see, you have to notice the red line is moving outward or inward. Now it's moving outwards. As you can see here, we have this point, or we can go just like this, complete our tracing here. Now we're outside the bone. At the last point, we need to do right click button, and then we just click on the close button. As you can see here, it's ready, the panoramic curve creation and the nerve tracing. Thank you for watching. See you in the next video.